Hi, Tommy. Uh, because my audience mainly in Asia, so can you like introduce yourself a little bit?
Yeah, absolutely. So awesome to be here. I really appreciate you having me on, Eric. This is cool. You've got a wonderful group of people that have been on here before me, so I'm honored to be included in that group. There, some legends before me. But my name is Tommy Otley. I'm a physical therapist and sports scientist with University of Miami basketball. Uh, I've been there for about 4 years now. We had a great year this year, which was fun to be a part of. But my role primarily is with long-term rehab, so anybody who's out for extended time loss, as well as helping with profiling, monitoring, and some of the stuff we do on that end as well, and just giving everybody as much insights as I can, and helping just fill any holes we have along the way. But I work with an awesome team of strength and conditioning uh, professionals, athletic trainers, coaches, sports nutrition, and many others. So it's a really fun place to be and a great team to be a part of.
Nice, nice. It's my honor to have you, man. Like you're really like well known in our field, so it's cool to have you. So I guess my first question is, you're the lead physical therapist and sports scientist. Most of like I guess most of the time it's strength coach slash sports scientist.
Yeah,
So as a physical therapist and sports scientist, like how does that work? And when it comes to injury, like what kind of data you're gonna look into?
for sure. Yeah, no, it definitely is a non-traditional route to that type of role, I would say. A lot of that for me came with my time with Duke basketball and getting to spend time with their head of like performance science. That was a big mentorship opportunity for me to kind of learn. And in that setting, their PTs have a lot of involvement with a lot of the wearable tracking stuff, force plate data. Uh, and I think for us, it's nice because especially in times when we're healthy, um, I can take on a little bit more workload from everyone else. So that works a little bit that way with the sports science stuff. But for me, it was just a big interest, and I think diving into it and trying to learn as much as possible, reaching out to people who know a lot more than me and learning and asking questions and everything. But I had a good framework of how to do wearable tracking with teams from my time there, how to do force plate testing, and then I think as time's gone on, have critiqued it and changed it just to fit our team and our setting because every team is a little bit different, every operation is a little bit different, and helping support the and involve the people that we have on our staff in terms of how it would best suit them and best work with them. So for us, that looks like a lot of stuff testing during the summer in terms of what we're looking at um, from guys and girls incoming. What can we do to help identify their needs? And we don't have as much time with them, unfortunately, always as we used to because transfer portal and everything. So really trying to figure out how can we make an impact as quickly as possible and identify where we can um, see some progress and improvements. Obviously, the tried and true stuff is tried and true. You can't rush art and you can't rush development and performance. But how can we maybe tweak things here and there that may help put ourselves in the best place, and then also self audit and see are we doing the things that we need to do to help people put people in their best foot forward. So we use a lot of data from our previous teams. We use data from any type of publicly available sources we can find that way too, just to help give us an idea of what the barometer is for where we're at versus other things. And then it's fun always with a new staff and a new team to identify what their needs are and questions are. So how can we use this to inform their training processes and their planning and preparation throughout the season and when we want to be training hard, when we want to be uh, modulating that throughout the season. So that's been really cool. From an injury standpoint, I think uh, great question. It really depends a lot of times on what we have. Knock on wood, we've been relatively orthopedically healthy for some time, but that always is gets disrupted. We've had stuff throughout the season this year that we've had to manage and stuff, but generally, I would say we don't take a very much we don't go super heavy on our pre-baseline screening stuff. We think we found what is our injuries in the past that we've had over, and that may change with the new staff and everything, but um over several years, we've had certain types of injuries that we maybe see a little bit more often, right? And if we haven't had a shoulder dislocation or a shoulder problem in 3 years, us taking the time to baseline strength test every joint is going to be maybe not worthwhile, right? But maybe we've had a lot of calf stuff or a lot of patellar tendon stuff. Let's dig into that area and see what we can do a little bit more, maybe identify some things that way. So I would say that's been the bigger part for us is just critiquing our summer stuff to figure out what that is. And then the summer block for us is really about building robustness and helping making sure we're ready for the rest of the season. So that's a big piece there. And then obviously when someone does get hurt, we've got a lot of really cool opportunities and tools to figure out what we need to get them back to and piece together that process as well.
Nice, nice. So you kind of already talk about this a little bit, but when it comes to like return to play from different injuries, like would your protocol or testing be different? And in terms of technology, what would you be looking at? Let's say like if you have an anterior knee pain
Yep.
versus a hamstring strain.
Yeah, for sure. No, definitely. I think if we've got a situation where somebody is dealing with some chronic tendon stuff, it's going to look a lot different than something acute right off the bat. Um, Thankfully, we've been relatively low on soft tissue injuries for some time, especially hamstring. I feel like basketball, they're either like the stretch type ones or we just don't run fast enough, right? Like the court isn't long enough to get up to those speeds, but we have occasionally had some adductor stuff and things like that too. But I would say that um, for the more chronic stuff in the anterior knee pain, one, first trying to figure out what the main area is, what the main cause is. If it's quad tendon versus patellar tendon, we may very much do different things, kind of in the same realm, right? But it's going to look a little different.
Can I interrupt you a little bit?
Yeah, go for it.
So I think this is the part that a lot of young coaches or young PT actually don't have like a lot of experience. So maybe can we dive a little bit deeper into like quad tendon and versus patellar tendon?
Yeah, I think one, just the location of pain is really key in identifying what's going on. You can have so many different types of tendon irritation and tendon pain. You can have insertional right on the inferior pole. You can have more mid tendon. There are much better people to talk about tendon rehab than me, but I'll give it my best shot. The big things that I've noted is when you're doing rehab, uh, and loading exercises, understanding if that pain is going to be more irritated by tendon wrapping and compression of the tendon or not. And that especially is true for Achilles tendinopathy, especially insertional, getting a little bit irritated that way. If you're doing like, um, kind of think about it when you're in that decline or that negative heel raise, you kind of get that tendon wrapping, it starts to irritate it even more. And that's kind of what the main cause of pain is for them is that compression in the tendon, or at least a piece of it. So for us, the loading is a really important part of that. And then tendons don't really adapt well without enough strain, right? It's not always about how much you do, how much volume you do, how much tensile. It's about the tensile load on the tendon to get it to adapt. And so a big piece of what we'll use technology wise is really trying to just help identify, are we outputting enough force to do that? And you can do this by, given as in a simple context, if you don't have technology, by making sure you've communicated to the athlete, hey, we really, even if it's uncomfortable, we're really trying to put enough strain on this tendon to help generate a response. But if you have the technology, even from just dynamometry is like super simple. Inline dynamometry on a knee extension machine, getting an idea of them, like they're outputting near a certain threshold of force. And so that's a piece for us. The difference between some of our setup for quad and for patellar is just the positioning of the patient. And so we may put somebody at like a patellar tendon that might just be in a nice little 45-degree angle sitting up. But for our quad, we might lay them back. So we're getting a lot of tensile load on that quad and putting them in a really advantaged position to kind of put as much tension and strain on it as possible.
Nice. So, uh, go back earlier, but this time, I want to be a little bit more specific. Like you mentioned, a lot of athletes will have groin injury, right? Versus, yeah, versus hamstring. Groin versus
That's a
hamstring. Like,
small sample size, right? Like that's our team. I do think it is a little bit less common for, I mean, especially basketball. It's not off the table,
no, I
obviously.
think it's actually getting more and more. It used to be less, but like,
It
I
is,
don't know
and I
why it's
think
actually getting more and more.
yeah, and I don't know if that's the pace of the game or is it, or what is it, right? You're also we're getting taller, always, and taller and taller, and so the lever's getting longer and longer. The game is. I just feel like, there's so many different things that could be a part of why that's happening, and I'm not, I haven't dug into it enough to be giving you great
It's all
information.
right. It's all right. I
But
think
for us, I think there's a lot, it's multimodal. You've got like increasingly longer and taller guys. Um, Even within college, it's just getting bigger and bigger, and and you've got a pace of a game like we used when I was growing up. If you score 100 points in an NBA game, it was wow, that's crazy.
every
And
now every
now
game
it's
is like 100 something.
130 points, right? And so that you're getting up and down a lot more. So I would imagine like you think about it from a soccer standpoint, which has been covered a lot more, is that the game is changing and they've done some really good stuff. I think in the Premier League, especially in how the game has changed year to year to year, and a lot of that for them because they've were really early adopters in a lot of the wearable tech. You'll see like high intensity distance coverage changes, just total distance coverage changes, and all this stuff that's been progressed and monitored throughout soccer because it's been a very popular piece of their development and preparation process. Where basketball, we have that stuff, but we just haven't looked at it like soccer has, I think, in the same way. It's also challenging because they've got GPS. A lot of us are restricted to IMU systems, which are just going to be a little bit less accurate in that high intensity kind of threshold work. But I think with the advent of Hawkeye in the NBA and us getting even more and more optical tracking options, you might start to see some research. I would assume we see something following that in terms of that. It may not look like high intensity running because it's a little bit different, but maybe possessions, you can see a lot of different things like that. But I think those are two pieces for me that maybe are contributors to uh, potential contributors.
Yeah, because it's not like football. They're gonna run like 20 something miles per hour. Basketball, you're never gonna do that, right?
No,
And it's not like track. You're gonna run like 10 meters per second. No, you're not gonna do that.
no.
But somehow I feel like we are getting more and more soft tissue, right? And I do feel like the speed of the game definitely contribute a lot. And since we were talking about this, what are your thoughts on mm, adductor squeeze for groin injury or like hamstring curl for Nordic hamstring curl for hamstring strain? I'll say this. My personal bias is like I like to look at how is the pelvis aligned or not, or uh is the SI joint stuck or range of motion is limited or not. That's my
Yeah.
personal bias. But what about you? What are your thoughts on these stuff?
Yeah, yeah. I think going back to the isometric type testing and stuff, I I think there's definitely merit in those things, right? Like you got to have. I always think about. I think I got this from several people, but isolating to integrate, and so you have to have the core pieces of of strength, of motion, all those pieces have to be there. If strength is the weak link in that, and if force output and what your tissue can withstand is the weak link in that, then maybe the isometric strength testing is a piece. But I think there's also a lot with position and all that stuff as well. Like especially there's been some stuff with running, right? And hamstring injury about pelvic alignment and anterior tilt versus not. Um, I think there's a lot of challenges in terms of how you look at that because that's right, it's active, they're moving, right? And a lot of the studies are a little bit harder to understand if that's going to be great. Yes, you're going to get more tension on the hamstring, but is that a bad thing? We don't know, right? It's maybe used to that, right? But uh but I don't think strength doesn't tell the whole story, right? That's why we can't just measure every muscle group at the beginning of the season and go, oh, okay, you're not going to get hurt. There's a really good couple good research papers, and I'm definitely going to mess up the citation for this one, but they look at um, four different kind of use cases. The first one is like you're strong at the beginning of the season and you don't get hurt. And so we go, oh, great, strength and you don't get hurt. Then we have the next one, weak and they got hurt. Okay, that confirms our bias that if they're weak, they're going to get hurt. And then you have the next one, they're strong, then they get weak and they get hurt. Okay, so we're really on board with this. But then you have one that goes weak, gets strong, and they get hurt, and then we're like, oh, we don't know what happened, right? So I think having these tools can be helpful, but it may not, it's not gonna help us prevent things from necessarily happening in isolation. And I think I'm more of an adopter of the terminology of injury risk mitigation and maybe reducing probability of it happening, but where you can't stop it. It's not preventable necessarily in the sense that you can say you're not going to get injured, you are going to get injured. But maybe we can decrease the likelihood that this does happen to you by giving you the best tools and giving you the best capacity to handle what you need to do. So,
Nice, nice. All right. Still want to backtrack a little bit. You talk about wearable technology and uh probably Europe soccer have like a lot better research than we have right now.
mhm.
But when it comes to like return to play and like the IMU system or like LPS system, what kind of metrics would you be looking at when it comes to like let's say a long-term rehab guy?
Yep. So I always like to begin like with the end in mind. It's a reverse engineered process. Like we know what they did before, we know what they need to do before. If there is somebody who maybe is a freshman coming in with a problem or a transfer coming in with a problem, maybe we don't have pre-injury data on them, but we know what a guard looks like that will play their expected minute range or right. So that's always like the target is what do we need to do capacity wise? And then try to work backwards from there. I think at the same time, you're working forwards from wherever the acuteness of injury is, and you're kind of taking these two ends and trying to figure out, all right, when is it going to hit that critical time point where we're going to really start utilizing the technology for that more? And that always for us begins when their return to court progression starts, right? So whether that's running, skipping, jumping, doing that initial stuff on court, we like to start throwing stuff on them and seeing where we're at with things. Um, the main part for us is that when we get to that court and practice transition and involving with skill coaches, that it's a really helpful piece for helping us monitor what goes on. To me, that is one of the most critical pieces that we bring in. um, you can, in an outpatient setting, that's on you a lot of times when you're a PT, right? Like you might be the strength coach, the PT, and like trying to be a basketball skill coach all at once because the kid doesn't have a lot of resources, right? Or they don't have all those other pieces. But when you're in a team that has all that, like use it. Don't try to, I'm like, I don't go out there and I'm not always like passing the ball. All right, we're gonna do this. I'm gonna bring a skill coach in. Like this is their job. They're better at that than me. So but at the same time, it has to fit the rehab progression, right? And so that's a really nice process where you can collaborate um, and optimize that for the kid and for the progression. And so, so for us, what we do is really try to um, identify what that looks like, and we do a lot of clipping of our practices and drills. And so, for us, every practice that we do, for the most part, we clip by drill by. So we have a big menu slash deck of data that has an idea of what this looks like from our system. And so we can identify and chart like these are going to be the ones that are going to have a lot more change of direction. These are going to be the ones that are going to have a lot more high intensity running. And when we put it together, all right, we may not be shooting for a number. And I always like to avoid this with coaches. Like, I'm never going to give you a, like, you're never going to see me waving in the back of practice saying, hey, it's too high, during practice says I'm gonna get fired, but what you'll see is like, hey, like pre-practice we have the practice plan and we're working with, this is a new year, so we weren't able to do this all this year with a new staff, but now we have a drill deck for this staff, right? And say like, hey, like this is what you're looking at the beginning of practice. Um, and we meet really regularly about what team practice should look like that, with the strength coach, myself, athletic trainer, head coach. um, and we it's not numbers that we're spitting out, it's more like emphases of the day, right? And so is today going to be a barn burner, hard get up and down day, and we need that? Then we know what those kind of days look like, right? And we know what to expect on those days. If we want a day that's more recovery, more shooting, more mobility type stuff, we're going to mirror that across the board. And we do take a little bit more of a quadrant type approach. And I like to apply that into rehab process too. And so where we've got, and by quadrant approach, I mean keep your high days high and your low days low, right? So you get the opportunity to recover. I try to apply all that back to the rehab because they're going to come back and they're going to fit back into that system with the team. So let's build it along the way as we go, and try to mirror that. So that way, when we have a thing, we do a lot of calendar planning of like, hey, this is what this guy's day is going to look like. And when I talk about reversing engineering back, we try to, you can't project it, especially with rehabs, because they like, tomorrow they might be like, I'm sore, my knee's blown up, and we gotta slow it down. Okay, well, it just tweaks everything in the future, but um, it helps keep everybody on the same page utilizing that. And so when we're using wearables for that, it's more so, are we hitting the range of type of exposure that we want for this athlete along the way, as opposed to maybe a specific number? It's like, hey, this is the target of stuff that we're trying to do. Um, are we doing it, and are we building towards the capacity that they need to have later on? And then IMUs particularly are not great with intensity metrics, or not intensity, but high speed running. Anything that gets high, it just gets more variable, right? It's not as good as LPS system or a GPS. So to me, I think, sometimes you gotta rely on the coach's eye on that stuff too. And so asking, hey, do you think he's explosive off his first step as he goes with this? Is he driving right as well as you thought he was before? Is there things that you think we need to work on that are missing here? All that type of stuff I think is important too, because um, it, we can't it's a balance of both the science and the art of it, I think. And if you can pull on people's opinions that know the game so much better than you do, then you should do so.
Nice, nice. I love it. I love it. All right. So, um, I want to ask you this before I ask you another question.
Yeah.
You mentioned like you also utilize kind of the quadrant when it comes to like, rehab.
Yep.
And me personally, like my experience dealing with uh medical staff or strength coaches, um, most of the time they don't really do the quadrant like high day, high, low stuff. They just do the same stuff not really every single day, but every
For
day just
rehab professionals.
yeah, just a lot of stuff every single day.
Yeah,
And
yeah,
some
yeah.
and
No.
sometimes
Oh,
I'm like, sometimes I'm just like I just confused like do a lot of stuff every single day. Won't they get fatigued?
yeah. No, I agree with you. And I think if you look back at early Tommy, that he was probably doing the same thing as that. So, but I think over time you start real like you can't rush the strength training process. Like you do, if you, and I think we forget this as PTs because we're not as generally as introduced to this, right? I got my CSCS. I know strength and conditioning principles now, uh, not, we really got to learn from people who have done this really well, right? And so for us, I think I even have adopted my rehab, sometimes not the core principles, because I think I hold true to those in terms of what my philosophy is, but I think um, the 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 expression of that sometimes changes for me based on who I'm working with as a strength coach too, right? And I think I value that relationship um, in that they're going to return to that training style, right? And how, like, for me, I have to hit the underlying capacities of what they're capable of. So say it's an ACL, right? Like, I have to get their quad strength back. Like, that is a non-negotiable. So I'm going to do that the way that I know best to do it because I've done it a lot. But in the realm of all the other training aspects, like I have to train them like they're going to go back to training, right? And it has to meet somewhere. And if I'm a really big uh like if I'm trying to train them like a football player or a soccer player, it's just not going to meet well, right? So it's just like I think that's for me is important. Um, and then you especially if you're lifting and loading things heavy enough, you can't do that every day, right? You just can't. We as a men's team, we lift like almost every day, right? Um, but that doesn't mean that it's always heavy, right? We lift every day. It just looks different. Sometimes it's groundwork and mobility and but it is a part of our routine that we know it's something we do every day. It's part of preparation for training. It's part of preparation for practice. Some days it's, you know, heavy explosive stuff. Sometimes it's recovery, right? But it's a piece of something that we do every day. And so rehab for me fits that model too. We do it all the time. It is something we're doing every day, but it's not looking the same every day. We need to modulate. And I think a big part of that is planning as a team, making sure your days fall together. And then the second piece is listening to the player too, and how are they feeling in the recovery process. And I think when you've gotten to uh two things, you've gotten to either levels of play where the athletes are very in tune with what they feel and their bodies, or two, they've been through things before because they've been playing long enough where this isn't the first time they've got hurt and they know when they're feeling good, and you really got to listen to them because they uh to the credit of athletes that I did not. I mean, I was an athlete growing up, but I think they players understand what's going on with them, and if they feel something isn't right or something is not right in the recovery process, there's a really important part to listen to it, and I entertain what's going on and figure out how things could be changed, modified, tweaked a little bit to make sure things go well. And so I think incorporating their feedback is critical too.
Nice, nice. All right, next question. Uh, when it comes to ACL, ACL is basically like a very common injury right now. Every team, every sport have ACL somehow. But when it comes to ACL rehab, like uh I don't think like um I think there are athletes come back from 6 months, there are athletes come back from 9 months, there are athletes come back even longer.
Yeah.
So timeline is not really a thing right now. So
Yeah, no, right.
but when like you said, they have to pass like certain testing or like you have to reach certain threshold to do the next thing. So can you kind of like walk me through like when it comes to like a ACL rehab, like what kind of testing you would do
Yep.
and how do you decide like is he able to come back to play or not?
For sure. Yeah, no, I think yeah, that's a great point. Like timelines are all over the place right now and especially in professional realm where you've got so many incentives to come back and reasons why you might come back or reasons why you would want to take more time, right? So it just depends on that. I mean, it shouldn't depend on that, but I think a lot of times it is. One thing I think I'll mention before like I start on that is that the body is a master compensator, right? Your body figures out how to do things into it will figure out how a strategy to do what you want it to do in some way, shape, or form. It doesn't mean it's the best way to do it. It doesn't mean that that's a great way or a healthy way to do it, but it will figure out a way to do it. That is particularly true with, I think you see the expression of that with ACL when you're um, in the rehab process, if you skip steps or if things aren't coming along and we move on, it'll find a way to do it. And I think that's something that is critical why you can't rush the process too much. You want to be on the cutting edge of them getting back, and you don't want to be waiting in a phase where they should have been doing the next thing because timelines are essential, right? We live in a timeline every year of a season, right? And so we have to optimize our points where we can hit enter those off roads from return to sport and back into playing or from rehab back into playing. Um, but I think that is uh, a a critical piece is just making sure that we're aware that if we skip steps, we're going to compensate something. So for ACL particularly, the biggest one is quad strength, and so I think a lot of the variability is how does that come back and how successful are we at getting that back? If the team is really following a strict guideline on what they intend for return to sport, which I don't think necessarily everyone does. I think we have some people that are, hey, I think that's good enough. Or the athlete's like, I want to go back. I'm going to take on the risks of going back. I understand the risks of going back, going without having met that criteria. We know that in certain populations, waiting a certain amount of time does help. But in other populations, it just hasn't been studied to that extent, I think. I think generally, that 9 month timeline on is has reduced injury risk, based on most, but it doesn't mean that you're not going to get injured. It just reduces the risk. The same thing with what type of procedure do you have? Did you have a meniscus involved with it? That will change the timeline too, right? If you were non-weight bearing, that's going to change the timeline. If you could just bear weight from the beginning and your surgeon's like, hey, uh, some of those studies have shown that it doesn't necessarily change your return timeline, but it changes the timeline of what things look like in the middle of it, right? And sometimes for me, that is very critical on what if you could actually do things later or not. If you're able to start getting into practice, you know, or basketball activities before 6 months, then it's a lot more likely that you're going to return earlier, than if you're not able to do so, right? Um, but for us, in terms of our core things we have to meet, is quad strength's got to come back. And we don't just do quad strength side to side because that side to side can be very deceptive, right? You've been out of training for a long time. If I just uh, take your quad strength at the end of rehab and go, okay, it's symmetrical enough, I think I'm doing you a disservice because I think for us, as soon as someone gets hurt on our team, before they have surgery, we test their uninvolved side. And so that becomes like a pre-baseline, unless we already have pre-injury data on them, which we do for a lot of players. But say we didn't have it, we would still test that uninvolved side at the beginning of rehab, before they even have surgery. And then we test uh, both isometrically early on, more as a biofeedback mechanism for training. And then eventually, once we get to a certain point, we'll test isokinetically, and then we'll kind of monitor throughout the rest of the rehab process. We're using two main criteria. We like to look at um, strength to body weight, and then we also like to look at symmetry too. I think both of those are important pieces to have. I will say we don't have the hardest stringent criteria, But I think for us, it's more about what is the story that this is telling versus everything else, and how does it look functionally and capable with their force plate metrics, with strength, and our team surgeon and myself, our athletic trainer. I think we all are on the same page as like if it's 89% versus 90%, should not be the decision maker why they don't play, right? But if it's 70%, that should definitely be a decision maker why they don't play, right? And so there's a grading sliding scale, I think, for us in terms of confidence in the opposite, um, in terms of what we feel comfortable doing. And that's part of the whole process of when we let them go back to certain things too, right? Um, at the same time, I think you have if you meet those functional capabilities, you still have healing timeline to think about, right? And so the tissue only heals as fast as it can remodel, as fast as it can remodel. And ACL particularly has to go through the ligamentization process. And that doesn't even finish at 12 months. So I think, you know, we got to remember that somewhere.
That's like
But
2 years, right?
yeah, it's like 2 years, right? So um, that to me is like a piece of it as well. And so I think you've got, and that's something that you can't predict that so and so heals faster than someone else. You just don't know, right? But I think giving the protective qualities of strength and of all the other pieces and movement, if they can move well, they can do that. You're trying to give them the best foot forward going into it, that this is the least likely you will get hurt with the while not missing another season, while not delaying return beyond what you need to. And I think, timeline of the season is a part of that too. And it's not a decision made in isolation. It's a decision that's made in context of a lot of other things. Um, Risk reward being one of them, timeline of the season in terms of what that looks like for play. Um, and I think another piece, sorry, I'm rambling, I feel like now, but the last piece I'd say is um, when it happens in the season, oftentimes impacts what they can get into in terms of practice and training. Because if the team is not doing the things that they need to do, you have to figure out a way to create that, right? So if they're like in late stage rehab and we're in conference play and they're not going to come back till after the season, right? The team is in practice not getting up and down like they were in the fall, right? And so preparation looks different if they're like, oh, we're set to return in conference play. Okay, maybe we're practicing over December. We're not practicing the same way maybe we were practicing before that. And so you've got to get these high stimulus environments for them to get exposure when the team starts gameplay where that might be changing, right? We're not scrimmaging all the time and they're not getting to do that. So it becomes a challenge of how they can enter safely with that too.
Nice, nice. I love it. So, quad strength. Feel like, well, actually, like you said, like a lot of times, like some of the cases I deal with, they use isokinetic at the end, and
Yep.
they say, yeah, they're 96, they're 95, 96% asymmetry, but uh when you really do like heavy single leg extension, there's like huge difference there.
Yeah, no, and I think I don't know if you've seen some of Wisconsin's work, Wisconsin Madison's work with Keith Knerr and the whole Badger Athletic Performance Lab, but they've looked a lot at the changes in rate of torque development too. And I think that's a big piece that we will try to think about as well. Is maybe you're hitting peak strength, right? Um, and so if we do isometric strength testing, oh, you can hit it, but you hit this one in zero point 0.5 seconds and it took you 2 seconds to hit it here. That's different, right? It's not the same thing. And so thinking about those torque curves that you get and what those look like is a whole nother piece that we're going to evaluate as well. And I think that expression you'll start to see in vertical jumping, things that are very quad dominant. It'll express that way too. So you might have a peak symmetry isometrically, um, But if the rate is different, it's going to express itself differently. So say you're maybe in a counter movement jump, it starts to look a little bit normal, right? In terms of braking and propulsive capacity, especially, it's going to be a little diminished for a while. But then you put them in a drop jump where it's this quick stretch shortening and this quicker like contraction, and it's just terrible, right? So I think you start to see that expression in different areas based on how fast can they produce the force, not just can they produce the force.
Yeah, yeah. And so, uh, quad strength is very important. So for an ACL, like, what or what type of test they need to pass for you to start implementing plyometric, even if it's like uh hopping or like assisted hop or like just A skip, B skip or
Yep.
what yeah, like what do they need to be able to do before you implement that?
Yeah, for sure. I think one is you got to be able to have a happy knee. That's my first thing. Knee's got to be quiet, and by quiet, it can't be swollen, can't be super irritated, can't be bad, and you've got to be able to maintain a good extension range of motion. All that stuff is primary for me. If we don't do that, we're going to be unhappy later on because swelling leads to increased inhibition, and you're going to have that kind of cascade lead you down a path you don't want to go. After that, um, a lot of it is functionally what can they do, right? And we build the bridge. We're not going to go from that to depth drops right away, right? It's a stage. It's gradual. And so as soon as they can uh and this is barring any meniscal involvement and stuff, but as soon as they can start to squat well symmetrically, do some stuff well that way, and we're being able to pull some weight around a little bit. I start integrating that as soon as possible. And so early foot contact stuff, just getting them doing stuff that's not going to put them in a situation where they're super uh, for lack of a better word, looking terrible, like super asymmetrical. But at the same time, I think you have this in the back of my head. I have this, I want to get them doing that stuff early. The other piece I have is that if they don't have the capacity to do it, I'm just feeding the compensation and I'm just feeding the ability for them to compensate. So there's a balance in my brain that's always going back and forth of if I just train them how to, or if I'm exposing them to things too soon, then they'll find a way to do it, and it's not going to be the way that I want it to happen, and or the way that it should happen from like a quad strength standpoint. That is why for me, I really try to keep things relatively vertical at first because then I can see like if you can't do it, your quad is not going to let you do it, right? Like if your quad is weak, you won't be able to do a single leg vertical jump very well. And so skipping stuff, I'm trying to keep it relatively stationary because horizontally they'll figure that out, right? They'll be able to have some glute, ham, all that, and they can move, right? They'll be fine. And they'll even find a way to land. It won't look pretty, but they'll be able to land. But if I can keep things vertical, it can kind of, for me, help figure out where I'm at. The other piece is with that is that I think if you build it along the quad strength coming back in terms and using that as like a little bit of a barometer to how where they're doing, that's great. The challenges with that is sometimes isometrically, especially early on, depending on their graft type. If that graft site gets irritated, the open chain type knee extension stuff is it's not bad for them, but it's going to hurt and it's not going to be comfortable. And so you may have quad deficits that are really due to pain, not due to actual force generating capacity of the quad. And so that may not look the same when they do a closed chain thing or something else where their foot's on the ground. So jumping might look fine, but they do knee extensions and it hurts, right? And so there's a balance of that I think you got to keep in your head too. But for me, it's generally get them into that progression as soon as we can, but it may look very different based on what they're capable of.
Mm. I do feel like you can pretty you can get them to do some escape a little bit assisted hop pretty early,
Yep.
but to build that capacity to let them able to handle horizontal jump, it actually take a long time.
Yeah, it does because you'll see that they'll take off fine from a horizontal jump, and then you see them try to single leg land, and the knee doesn't bend, they
Yeah,
hit, you have all that, and so. For me, I want to see them do it vertically. So I love doing like single leg box, not box jump, but like jumps off a box. So they're standing, it's like lateral step up jumps. And so you're seeing like when they come down to decelerate that, do they just hit the ground or are they slowing themselves down? And I use those as a like in pairing with skipping exercises a lot to make sure that we're feeding them the right dosage of plyo intensity particularly to help build towards that. And then from like a volume, I think a lot of PTs over prescribe volume of plyos and under prescribe intensity of plyos. And so you're going to get like a ton of foot contacts, right? But none of them are enough, right, in terms of intensity. And so I think trying to gear towards what is the ceiling on what I can hit intensity wise with them. And then I may not do a whole lot of volume today or based on to decrease the irritation of the knee flaring up or anything, but I do want to hit the ceiling of what we're capable of.
nice, nice. All right, last question. So shout out to Adam Petway. He did a study about prior injury that leads into Achilles tendon rupture in the NBA. And what they found is like most of them have like plantar fasciitis or rolled ankle and definitely some sort of calf strain before that incident. All right. So talk to me about calf strain. When like if someone have a calf strain, a basketball player have a calf strain that go to you, like what would be your rehab process?
Yeah, calf training is a tough one. I think especially now everyone's very afraid when it happens that it is something else or will lead to something else. So I think yes, there is uh, I love Adam and I love his work. He's given us some really, really valuable insights in terms of injury, biomechanics, uh, really good stuff on wearables, a lot of really awesome stuff. So yeah, no, shout out to Adam for sure. The um with calf strain for us, I think one, it's a team thing. It's not just a me thing in rehab. Usually with calf strain, especially in the climate now, we're getting imaging. We want to see the extent of it is, right? Does it go into the tendon? Is it a musculotendinous thing? Is it an upper? Where is this happening and what is happening? And so imaging for us is important. Uh, that being said, imaging never tells the full story. As in anything, low back pain, no whatever it is, right? Imaging is not the answer. You're not your imaging and you don't feel like you're imaging a lot of times too. So I think that being said, we want to see like what are you capable of doing? What is your capacity? How do you feel? Is anything changed in your mechanics? And um, are you compensating? And this is purely projection, inferring and me projecting on what I think maybe. But I think one, you do have some irritation and damage. If you do have that to the tendon, it's going to be weaker, potentially. The other piece is that um, maybe you change your biomechanics of how you do things when it happens. Um, Another study with Adam has done is looking at like how majority of those are all happening with the false step, right? And so to me, that is an important piece of the game though too, right? Like it's not something you can or will ever take out of basketball. False step is a movement that allows you spacing and gets you around somebody that some other things don't. And I think I want to say it may be Lee. I don't want to misquote Lee Taft, but I think it was maybe Lee, but like talking about how the false step is oftentimes a faster way to get there than just pushing off alone, right? And so your body's going to find the fastest way to do something. And if you can create space, movement, and get around somebody, that's not changing. And so I think understanding that that is not necessarily the villain of it, but it is just where that biomechanical it's at the most disadvantage. It's behind your center of mass. You're in super dorsiflexion position, and that's just what did it, right? That's when it expresses itself. That's where injury's happening. I think to me, m- he also noted that a lot of those happen with the externally rotated foot, right? Maybe the people are externally rotating your foot more if they've got something else going on. Who knows, right? Offloading the calf, a little gastroc complex, or that's just because that's how they moved and that's how the movement looks, and they're maybe getting a little more base support. Who knows? Um, but for us in calf management, I trying to wheel it back. Sorry, went on a
You're good, you're
tangent.
good, you're good.
But I think for us, what is the tissue quality looking like? Is it involving anything that we would be worried about or at risk for? Maybe something else right off the bat. Two, uh, making sure we develop strength and qualities back from a uh, strength standpoint into training, and then movement quality on the court. Are they moving well? Are they feeling well? Um, and are we hitting um, the things we want to hit from like a basketball movement standpoint, getting back that we feel comfortable going off of? Yeah, I think some of it is it there if they're a 1 foot jumper and it's that leg, it may be different than if it's their other leg, right? In terms of how well then quickly they may be able to progress too. Like if they're somebody who drives to the rim a lot and gets up off one, and that's the foot that they're hurt, that may impact the progress and how quickly they can become available again versus if it's something else, if it's a trail leg and that, all that too. That's not saying that we don't stop. We're not trying to rehab a trail leg well. It's just that the capacity that it's getting put under from a maximal standpoint might be different. Um, yeah, I think those are all pieces. The strength, again, isometric strength isn't telling us that tendon quality is good or anything like that, too. So you got to balance that. Strength alone is not going to tell you that, but it is going to tell you how well and comfortable they feel out putting force through it, and that can tell you a lot.
Hmm. Nice, nice. I love it. I love it. So, uh, that's all the question I have for you today. Appreciate you, Tommy.
Yeah, no, this is fun. I love chatting with you. Got to do it again sometime. Just
Yeah,
talk
of course.
offline or online. But this is fun. I really enjoyed it,
Yeah.
and it was great
Nice.
chatting.
Yeah.